I'm Max Crowley from Penn State University. I also am part of the National Prevention Science Coalition. I affiliate there with the Prevention Research Center. And so today what I'm here to talk about is valuing the investment in home visiting and the opportunities that come from making the investment in home visiting. So we've already heard a fair amount about the evidence review that's occurred. We've heard about some of the domains in which home visiting is known to be effective, and the confluence of studies that support the home visiting literature. So I want to take a step back though and think about some of the other things that you might have heard about home visiting. For instance, you may have heard conversations about the return on investment, right? Or the value from these programs. And what we wanted to do today is give you an opportunity to hear a little bit more about what does that mean and unpack that. So because sometimes those are just numbers and you might wonder, well, how could that be true? Or how does that actually come together? And what goes into that analysis? So what I'm going to talk about is the cost effectiveness of some of these programs in context to the problems that they seek to address, in particular in the context of child maltreatment. So a little bit about my background. So what I work in is around benefit cost analyses and prevention programs broadly, including home visited models, specifically thinking about when we make an investment upstream in the development of a child, what happens downstream in the future in terms of benefits. And not only can we create something that's cost effective, but can we invest in a way where we've actually, where we continually think about optimization. How can we invest fewer resources to get the same impact or a greater impact? And that's really kind of the legacy in the home visiting space. Is there's been work, as Lauren mentioned, for decades now in the space, and new models have come out and they've learned from previous models, and we've actually achieved this sort of capacity for optimized or better models, more cost-effective models. So I'll talk about that in a minute. But first I want to talk about one area I think of particular interest for probably many of you, and certainly for us in the groups that we have the opportunity to work with, which is protecting children from child abuse and neglect. So we know about many of the human costs that occur from abuse and neglect of children, and many of you may be aware that it's something that sticks with a kid across their life, right? This is something that once a kid is abused or neglected, then it doesn't go away. It follows them into all domains of life. It follows them through their opportunities for education, it follows them into their own families, it follows them into the workplace, it follows them into the doctor's office, and it follows them into many of the decisions that they make going forward, even with their own children. And so, but that also has economic implications, and that's one of the reasons that some of the first home visiting models were actually created, was that there was a recognized need to prevent abuse and neglect. Not necessarily, we do a lot to try to mitigate the harm that occurs after the fact, once a substantiated case has occurred, but the need the recognition that we can never truly mitigate all of the harm that's done in that case. We might be able to stop it from happening again, but that once it happens, there's irreparable harm that's been done. And that there's an economic element to that. So as I mentioned, abuse and neglect, we know, follows kids through their life, and it follows them into all of these different domains. As you can imagine, what it means is higher healthcare costs, both in childhood but also in adulthood. Higher child welfare costs, as you can imagine, because the incredible effort of our caseworkers in terms of substantiating abuse and neglect, as well as then trying to mitigate it, and then also the resources and infrastructure that go into maintaining a system for foster care and adoption and all of those elements. So those costs are, of course, incurred. But there's another area that we wanted to make sure was on everyone's radar as people think about this area, which is a tremendous amount of cost has to do with the productivity in the workplace. This is an economic issue in its truest form, in that this is a labor market, a jobs issue. This is an issue of employment, preventing child abuse and neglect, that is. And So there are many estimates of the cost per child who's been abused and neglected, and none of them can really do justice to the true human cost. But that doesn't stop economists from trying to think about what those might be. And what that number can do is provide a useful metric for understanding how services like home visiting might be an effective and cost-effective approach when we think about all of these other costs that occur if we can prevent it, that would not occur if we can prevent it. And so that cost varies from around $200,000 for a child who's abused and neglected, which is on the lowest end of that spectrum, all the way up to, as you can imagine, well over $1 million, even more, for just one child, right? So you can imagine that if we can prevent that, the societal benefits there. So I'm not going to talk about necessarily the benefits that accrue to government. That's not what we're here to talk about today. But what we are here to talk about is the larger societal benefits. But you can imagine all of the costs that are picked up by the taxpayer in these cases. The child welfare costs, the health care costs, the costs of social services and public assistance for children who grow up and become adults and are unable to either become employed, or even when they do become employed because of mental health and other issues, can't perform to their full potential in the workplace. And so what I want to talk about is 3 programs. Lauren already mentioned 2 of them. So Healthy Families America, the Nurse Family Partnership Program, as well as the Safe Care Program. All 3 of these programs are on the HOME list. They've been shown to have the highest level of evidence and can be supported through resources. But what they've shown is an impact, a measured impact on preventing substantiated cases of child abuse and neglect, right? And so we directly have observed those benefits. And as Lauren mentioned, this isn't just a couple of years from the time of implementation. We're talking potentially decades or through the entire course of childhood that these programs are going to be effective for. So for instance, if you think about the Safe Care Program, for every 100 kids who receive the Safe Care Program, there's the opportunity to prevent, on average, about 6 cases of substantiated child abuse and neglect. Each of to provide. But then we want to take a step back and think about what's the investment? What's the investment that's made? And that, in the context of Safe Care, it costs about, on average, and of course it varies by context, about $2,000 to provide safe care to a child, and a child who may be at risk. And but the question, of course, is what is that investment? And also, as Laura mentioned, different programs have different benefits, and many of these programs have benefits much more broadly than just for child abuse and neglect. And so, for instance, the Home Nurse Family Partnership Program, for every 100 kids that receive that program, based on the parameters of the population that program serves, we know that up to potentially 25 of those kids may not encounter abuse and neglect. But of course, the Nurse Family Partnership Program, a very robust program that provides services for multiple years, including prenatal until after birth, is slightly more expensive, right? In terms of being around on average, estimated about $10,000 per child. But of course, it has a greater benefit. So one of the key takeaways that we want you to have as you walk away from here today is, so what is the cost effectiveness? What is the cost to prevent a case of a child from being abused and neglected through home visiting programs? And based on the evidence, based on the literature that's been conducted over the last few decades, what we know is that those benefits are a cost of between $20,000 and $40,000 to prevent a case of a child from being abused and neglected. Now hold that against that lowest cost of child abuse and neglect for one child across their lifespan of over $200,000. We know that can be higher, and think about what $30,000 or $40,000 is relative in terms of a societal investment here. And that's what we want you to know going forward, is that making this investment, it not only makes sense from a human standpoint, but from an economic standpoint, from how we invest in society.
Thank you, Max. I know I was